All right, now we're going to show you some hearing aids. First, you would want to identify the right versus the left hearing aid. In this scenario, this is the right hearing aid because it has a red tip on the end. This helps you identify right versus left, like if you were in a classroom and needing to put them on a child or, say, a patient that you might be working with. This is an example of a left hearing aid. It would fit on the ear like so. And the reason we know this is because it has a blue tip on the end. So right is red and blue is left. Now I'll show you how to actually put it on the ear. So as you can see, it fits, it looks like it goes to the right, so you could also follow it that way. But you take the hearing aid and you first would want to stick it onto the back of the ear, like so. I don't know if you want to get a little, and then you want to actually stick it into the ear canal. And once it is flush with this part of the ear right here, you know that you have achieved putting it into the ear far enough.
So this is an example of a hearing aid without a dome on the end tip, which is also called the receiver. And before a hearing aid ever goes in someone's ear, you want to make sure that the dome is on there. So this is an example of a dome. And to put it on, you're just going to stick it on the end of this tip, the receiver, and you want to make sure that it's really snug on the end of the tip, and you want to push it down as much as you can, because when it goes in the ear, you want to make sure that it can't get stuck in the ear canal. So this is important to make sure that this is on the hearing aid before you maybe help your client put it in their ear. This is one type of dome that you might see on a client's hearing aid, but we also want to mention that there are several different types of domes of different sizes or maybe slightly different shapes that you might see. Also, some hearing aids have an ear mold that goes into the ear that's custom to your client's ear shape. And a lot of the times, children will have hearing aids like that if you have clients in that age group. But also adults can have it as well. So we just want to mention that it might not be a dome and it could also be a custom ear mold.
Another thing that's important to know is how to turn the hearing aid on and off. So for this style hearing aid, it has a battery. So you're just going to open the battery door like this. And then this is where the battery would go. We'll talk about changing batteries in a minute. You would open the battery door, close it, and then the hearing aid would be turning on. If you're not sure if the hearing aid is on or off, you can always open the battery door, close it, and then you'll know the hearing aid should be turning on. So to change a battery, it'll come in a pack like this with a little tab on the end. You pull the tab off, and then it's a little disc. And then when you open it, there's a little slot, and you put the battery in the slot to where it fits flat. So the flat side goes on the bottom like this. So when you're looking at it, you want the round part to be at the top. And you close the door, and the hearing aid will be turning on. Some hearing aids don't have a battery like we just talked about. They're rechargeable hearing aids. So if you wanted to turn those hearing aids on or off, there's a button on the back of the hearing aid right here, and you hold the button down and you would listen, and it'll start beeping when it turns off. So if you're not able to open the battery door, push and hold the button, and that'll turn the hearing aid off. Once you don't hear any sound coming out of it, push and hold the button again, and that will turn the hearing aid back on.
Now we're going to talk about cleaning hearing aids. So it's very important for the hearing aid to be clean so that when your client puts it onto their ear, there's no debris in the microphone holes or any other part of the hearing aid so that they can hear to the best ability. So first you want to try to identify the microphone of the hearing aid. Usually it's on the back of the hearing aid. if you can't identify it, best case scenario, just try to brush any hole that you might see. So there's a hole right there, as you can see. So we just want to make sure that no debris gets in that hole. So just use any type of brush that you might have laying around and brush that off. You could also brush near the battery door to make sure that there's no debris possibly getting in there. And then also you might want to consider brushing the receiver tip of the hearing aid right here that Becca talked about earlier. And the reason we want to do that is a lot of time this gets occluded or gets clogged up with wax. So you just want to brush the end of that and make sure that it's all clear and ready for your client to be able to hear the best that they can.
So now I'm going to talk a little bit about doing a brief listening check on a hearing aid. So if you find yourself in a situation where you're not sure if your client's hearing aids are on or if they're working correctly, you can try taking their hearing aid and just putting it in your hand, and typically you might be able to hear a little bit of feedback if the hearing aid is on and working. And you can also put it up to your ear and talk a little bit and see if you hear anything from the hearing aid. Let's say you do that and you don't think you hear anything, you don't hear any feedback. You can do, like we mentioned before, opening and closing of the battery door. Again, this will turn the hearing aid off and then back on. And when you turn it back on, you should be able to hear these few starting up tones. And that will mean that the hearing aid is working correctly and that the hearing aid is on.
So once you've done your listening check, if you find that the hearing aid's not turning on or isn't working, then you can either talk to your client or their parent that you think there's something wrong with the hearing aid and they need to go see their audiologist. Or if the hearing aid is on and working after you do your listening check and you still don't think that your client is able to hear you, you could do the Ling 6 sound test. And if your patient's not able to hear those sounds, then you should tell them or their parent that they should see an audiologist to have their hearing tested.